I do apologize. I know these have gone a little longer than they should, and I'm trying really hard to make them as quick as possible, so I do apologize. Sometimes I think I go back and forth between whether I should just be writing all this down or just providing this in this kind of format, and so I'm going to just keep pushing on the video format, and hopefully this will be significant. So I'm going to focus on social policies, and of course we're going to be talking about health and the long-term care and how that takes place. There's a lot of things we're going to cover here. This is one of the most, and again, there's some chapters that are really important, but if you really are like trying to dig down to understand gerontology as a whole, right, the areas that are particularly of significance are, of course, the biology, which means health, right? The psychology, right, which means the mental and the cognitive and so on. You can then talk about the sociology, which means the way in which we think about aging as a social construct, and of course the social networks that people have. And then you start thinking about specific things like caregiving and death and dying, and of course race and ethnicity and the differences that exist. We are a diverse nation, and that is going to continue whether some people like it or not, and that's just the way life is. And that means that there are different ways in which we need to think about how people experience aging and what their expectations are. And of course, on top of that, we then have social policies. Policies is one of those things that affect the process of aging. There was a time where people were forced to retire at a particular age, and then of course we have the Age Discrimination Act that was passed, and this kind of like ends that idea that people who reach a certain age have to be forced to retire, right? This is the so it's one of those things to kind of keep in mind when it comes to policies. And of course you then have some huge policies that you're all very familiar with, like Social Security, right, and Medicare. These are two programs that are particularly important to older adults. So social policies is this area that kind of sits out there and is extremely important. In many ways, it's what has kept a significant number of older adults out of poverty. Many of them still are, too many of them are, but relative to, for example, the younger population, older adults tend to be a little bit better off, and part of it is some of the policies that are in place in order to try to protect older Americans, or particularly older Americans, but older people in our society. If you think about it, right, the Social Security Act comes out of the plans that came out of the Great Depression, right, our attempts at trying to do that, and so we're finding that one of the most vulnerable population, yes, kids were vulnerable too, this is not throwing that out of the way, right, this is why you had focuses on, programs to support kids, but the adults who were older were experiencing significant amounts of poverty, and they were not able to work, right, where you had significant number of people who are capable of working within the United States during the Great Depression not being able to work. Older adults in the Great Depression suffered incredibly, and so this was an attempt at trying to remedy some of that, right? So Social Security becomes a way in which we try to, this is why, interesting enough, it's built the way it is, right? The current workers put into the program in order to support the current people who are retiring, right? So it's the active labor force paying for the current people that are retiring, and you are putting money in place in Social Security so that you can support them, with the idea that when you reach Social Security age, you then will also start receiving money from the people who are in the work. So it's why it's so important to really pay attention to the number of people in the labor force that are working. Now, there's a lot of issues with Social Security that people argue about and complain about, and so I'm just going to mention real quickly, there is a cap on Social Security payments. So if you make over $174,000 a year, you're capped on your Social Security payment, and therefore you don't pay more into Social Security, whereas everybody else is paying up to that point. Once you reach that point in income, you're no longer paying any additional Social Security. So that is one of the barriers to increasing Social Security and securing Social Security, is that the wealthiest tend not to pay their fair share into the system. The idea is that, they don't need it, so why are they paying so much for it? But that means that those people who do need it may not have it. And so there's a lot of issues with how we're collecting for Social Security, but that make it kind of vulnerable. Of course, the fact that such a large number of our labor force is not available to work, that can be very problematic as well in the generating of funds for Social Security. And as people age, and they age longer, and they live longer, and they collect more, that puts more pressure on the Social Security system to provide for these individuals, and it becomes this kind of precarious kind of system. However, it is a good system, and it has worked extremely well at trying to keep people out of poverty. A lot of people have talked about the issue of retirement as a three-leg system, right, where you're supposed to have Social Security, your pension, and then you're supposed to also have some sort of savings, and these three legs are supposed to support you in as you get older and you retire. The reality of the circumstances is that for most people, Social Security is one of the most one of the only ways in which they actually continue to earn income as they age. They might get some sort of pension, they might have belonged to a 401k and gotten that returned back to them, but the Social Security payments are extremely important for a lot of people in the United States, and it's one of those things to keep in mind. Other policies that have been put in place, elder abuse policies, which are extremely important. Older people tend to be extremely vulnerable. I don't know if you've had a chance to pay attention to this, but if you haven't, there are a lot of horror stories about what happens in nursing homes to older people. Of course, older people are extremely vulnerable from their own family members in some cases, from neighbors. Obviously, you know that older people can be extremely vulnerable to people who are trying to scam them. This is not new. They're usually the target for a lot of these, so there is a lot of laws in place to try and prevent this as much as possible and try to support a lot of these people, so especially as they're aging through this process. So that is particularly important. With this chapter, think about the issue of retirement, disability insurance. These things are going to be important. As people retire, what does it mean? At what age do you retire? Social Security, for example, begins to pay out at 62. However, they start paying out at 62 at a much lower rate than if you wait until you're 65. At 65, the rate almost, it adds almost like an extra quarter to the amount that you are going to receive. It's based on the income that you've earned over the highest income that you earn over a 3-year period or something along those lines, and it's averaged out of that income, and then that determines how much you're going to get, and up to a cap. There's a cap on that as well. You're not going to get the same amount that you've earned, but by the time you turn 65, it goes up by almost a quarter, and then by the time you go to, if you wait until 67, it goes up by almost like another quarter on top of that. So it could be retiring at 62 or collecting Social Security. You don't have to be retired to collect Social Security. You can actually submit an application for Social Security as soon as you turn 62. It does affect, your income does affect how much money you get, which can be problematic, but you can put in for your Social Security at 62, but the amount is going to be significantly lower. If you wait until 65, the amount goes higher. If you wait until 67, you collect full Social Security and you get, by that point, it's much more significant. This is why a lot of people say wait as long as you can, if you can't do that, but unfortunately not everybody can, right? There is certain occupations that really tear down the body and do not allow you to work past a particular point in time. For a lot of people, you start to see disabilities, for example, begin to really increase once you start getting to the age of 55. You see, like, for example, studies that have looked at people who do blue-collar work and working class kind of work, and you see that the disability really starts to skyrocket for them, their ability to be able to do things. Just everyday living kind of statistics show that those numbers tend to be much more impactful once you reach the age of 55. So now imagine between the age of 55, waiting to be 62 to be able to collect your Social Security, and of course being penalized for that. There's also a question of the quality of life that happens. Like, if you wait until you're 67, how much can you do after you get past the age of 67, right? How mobile will you be? Will you be able to enjoy retirement, as they say, by being able to do things that now, you're able, you can do because you're retired, right? And since Social Security is there to help you pay your bills, the question is, are you capable of achieving the things that you want to do if you wait longer to get your money, get your Social Security money? It's all those types of things that need to be incorporated in this, and I think are important to this. And of course, pay attention to the issue of elder abuse with this, because that has been significant law in the United States. Also, we need to think about long-term care, right? And there are several programs that are put out there that have really helped older Americans, right? The most significant one, of course, you've got Medicare. Medicare is federal insurance for people 65 and older. There are 4 parts to this: Part A, Part B, Part C, Part D. There used to be this thing called the Part C donor hole, which is private advantage plans, where you had to, if you made too much money, you had to pay into these private advantage plans. But then now, because of the Affordable Care Act, that has changed. The Affordable Care Act has really changed healthcare for a lot of older Americans. It's provided a lot of benefit. Yes, Medicare is there, but as the Affordable Care Act was passed, there were a lot of loopholes that were closed for people on Medicare. So this is one of those things that's important. Medicaid is a different program than Medicare, where Medicare focuses on people who are 65 and older. Medicaid is a joint state and federal. The state provides block grants that gives it to the states. The states then run their Medicaid program. For a lot of states, they're part of the ACA, the Affordable Care Act, is through Medicaid. Right, they provide it through Medicaid. Some states refuse to accept some of those programs, so they don't. Instead, what they do is that they allow for private businesses private insurances to provide medical insurance, to provide what they call low-cost insurance for individuals in these areas. But a lot of states, particularly Massachusetts, New York, Minnesota, several others California obviously have great Medicaid programs to help cover their populations and people who are low income. And so people who are older can take advantage of Medicaid program if their state has a good system put in place, right? This creates issues of inequalities across state, something to pay attention to. Long-term care, the range of services ongoing for, this is one of those things that becomes problematic, because the question is, at what point do we continue to pay for these things? How long would they cost? What are they, are they cost effective? These are the kinds of questions that you need to think about when it comes to taking care of older Americans. And obviously, this is the same questions that you would ask about all people in our society. And I'm focusing on Americans, and I say Americans because a lot of these programs, you have to be an American citizen to take advantage of these programs. If you're not a citizen, you will not get Social Security. If you're not a citizen, you will not necessarily qualify for, well, you don't qualify for Medicare. You could get a form of Medicaid, but the state would provide it usually out of the state coffers. The federal government does not allow for Medicaid to be given to people who are not citizens. The only exceptions to that are people who fall under special refugee status or some sort of protective status that then allows them to qualify for these programs. And those are really small numbers. These are not very large numbers. Other than that, you have to be an American citizen to qualify for these programs. So that's why I keep saying Americans, right? It's not to make you think like other people don't count. It's that these programs have a very specific target, and if you are not, then you do not qualify for that. Which of course brings to question like what happens if you are not a citizen. And you're aging, and you've paid. Usually, if you paid into the system, you're just not going to collect from the system. This is one of those things that in our society we kind of had like fallen into this kind of like gap where kind of no one really pays a lot of attention to or focused on. So it's an interesting area of study to consider. Anyway, I wanted to make sure that we covered at least up to this point, and I think I've gone long enough about this. Your book does a great job of covering this. I just want you to understand the significance of policy and when it comes to aging.